royal correspondent, Sarah Hewson. Sarah, before we get on to any updates about the Princess of Wales and, in fact, the King, we've been talking today here on TalkTV about a different approach when it comes to illness with major royals. The King has been extremely frank, and we were delighted to see that following his intervention, the number of men, I guess they probably were all men, inquiring about challenges in relation to their prostate had gone up 11 times on the NHS website. That shows our fantastic campaigning King using his own personal ailments to help our country here in Britain. But this is something new, and do you think we will see more of it as the years go by?
Yeah, it's really remarkable, isn't it, Jake? 1,000% increase for the NHS's website for their prostate enlargement page, trying to get information about it. Now, I'd like to think it's not just journalists like me who were searching the page, and that actually the King's announcement had encouraged men to look at it, look at the symptoms, and to think about whether they might need to seek medical advice at some stage too, because that was the point of his announcement. In the past, members of the royal family have given statements to let it be known that they might be receiving medical treatment. We'd have very, very limited information about why that was. And the decision was made by the King that he would put the information out there about his condition, about his diagnosis, in the hope that it would help other men to do so. And I really do think that's a shift. Yes, it gets ahead of the story as well, because it would have been obvious, wouldn't it? He was having to cancel some of his duties. It avoids the panic that a sudden absence of the monarch might make, but also, hopefully, tries to break down some of those taboos and barriers around talking about issues like this, and shows that the King is human.
And of course, as royal editor here on TalkTV, we know you would have been on the NHS website, but there's only one of you, and there's lots of people out there who are looking, which I think shows the success of the King's intervention. In relation to the Princess of Wales, we see that William has been visiting her in a hospital in Marylebone in London. Do we know anything more apart from the quite high-level facts about her having an abdominal surgery?
No, Jake, in Kensington Palace made it pretty clear that they wouldn't be giving a running commentary on this. When there is any significant updates, then they will make those announcements. But they made it very clear they wanted to respect the Princess of Wales's privacy. Looking at pictures of the Prince of Wales, he visited her in hospital yesterday. I think we can probably expect him to be back there today as well, in between doing the school runs. We have seen the King today for the first time since his announcement. He was seen being driven in a car from Birkhall, his home on the Balmoral estate, through Aberdeen. Now, we don't know where he's going to be receiving treatment next week. We know he's going to be in hospital, that he will have this procedure for a benign enlarged prostate, but Buckingham Palace haven't confirmed whether that will take place in Scotland or whether indeed he is returning to London for it. But he was with his wife, Camilla. She was out and about yesterday, and she said that he was fine and looking forward to getting back to work.
And do we have any indication when the King will, in fact, return to work, and when we may see the Princess of Wales returning to work?
No, we're told he'll have a short period of recovery after the procedure, and so we won't see him probably next week on public duties. I have read some reports that he would be off duty for a couple of weeks, although I think the recovery from his particular procedure is pretty short. So we'll wait for information on that from Buckingham Palace, although they have assured us that he won't ever be off duty, as it were. He won't be incapacitated. So there's not going to be any need for the councillors of state, those members of the royal family who deputise for the monarch, should they suffer a period of ill health, be in surgery, unconscious, for example, and unable to conduct their constitutional duties. And he will be receiving his red boxes all the time, so carrying on working, just not in public. As for the Princess of Wales, a much longer period of recuperation. We're not expecting to see her until April.
And of course, I mean, I have had the privilege with Her Late Majesty the Queen of seeing her ruffle through her red box. I think people in this country sometimes forget that every single law goes to our monarch to be approved, and I can, without revealing any state secrets, I can tell you that they always take a distinct interest in what their politicians are up to in their name and on their behalf. In relation to the king, then, we understand he'll be back on royal duties, but you talk about these councillors of state who can take over if for any reason our monarch is incapacitated. What do they actually do, and who currently fulfills those roles?
Well, the councillors of state, Jake, are the monarch's spouse, and so Camilla, and the four next in line traditionally. So that would have been Prince William, Prince Harry, Prince Andrew, and Princess Beatrice. In 2022, there was an amendment made to the Councillors of State Act, and two more were added. So that was Princess Anne and Prince Edward, the other siblings of the king. And it has been noticed that in that act, it was amended to say that only working royals could act on behalf of the monarch. So that takes Andrew, who's no longer a working royal, and it takes Harry out. It also takes Princess Beatrice out of the equation as well. So we are left with Prince William, who we know is looking after his wife. And therefore, it would be up to Princess Anne and Prince Edward. They have to act in partnership, two of them in a quorum, in order to conduct any constitutional duties. So, for example, giving royal assent to a government bill. But I think Buckingham Palace is pretty confident that on this occasion that would not be called for. But certainly this is the sort of thing that they had in mind when they made those changes.
Sarah, thank you so much for joining us here and giving us that fascinating update on actually how our constitutional monarch fulfills their role in terms of still approving all acts of Parliament. Isn't it great to be British, everyone?